Hey, thanks for tuning in to this little video about fiber structure in the iris. Do me a little favor, would you? Would you make a point of liking the video, drop a comment, subscribe to my channel, and share this with a friend? Thanks so much. As we go through this, we're going to be looking at lots of eyeballs today. What we are looking at today is fiber structure, and specifically, we are looking to see if there's anything unusual happening in the fiber structure. What I want you to remember as we're looking at this is that the fiber structure is inherited. This person did nothing to create their fiber structure. The fiber structure is what they've picked up or been given from their parents, grandparents, and great-grandparents. And so as we look at fibers, I want you to be aware that what we're talking about is these things that look like threads radiating outwards. Now, they're not actually fibers. They are something else, but we describe them as fibers because that's what they look like. You'll notice with this set of eyes, and this is one of my clients who's in her mid-50s, you'll notice that her fibers look very organized. They look like somebody literally combed them, right? They're all radiating outwards, they're neat and tidy. Even in an iris that is this well organized, we have a few fibers that are a little bit wonky. We call them transversals. So this is her right iris. And as we look at her right iris and we look down here, we see that we've got this one fiber that is crossing some other fibers. We see that up here we have a fiber that is crossing some other fibers. And in her left eye, we've got this fiber that is crossing other fibers. These types of fibers are called transversals. Now, we're going to be looking at a lot of transversals and talking about what they mean. And as you know, with iridology, we never diagnose and we never prescribe. So we are not able to name a disease process, and we are not able to name a cure either. So again, when we look, this is another one of my clients, she's in her early 60s. And when we look at her eyes, what we see is again, that we've got transversals. Now they're a little harder to see in her eyes because she has so much of this white cloud in her eyes. But for instance, in her left eye, can you see this one coming down here? Let me know if you can see this transversal in her left eye. Just give me left eye in the comments. Okay, left eye. And that will let me know that you can see this one fiber that's coming down at an angle here. And Ashley can see this. Very excellent. That is so excellent. And so, and we've got Megan saying yes as well. Thank you. And Sherry is saying left eye. Fantastic. That's great that you can see that. Remember when we're talking about iridology and we've got Shanaz and Teresita? Oh, hi, Teresita. Good to see you. So many people that I'm familiar with. This is fun. When we see these fibers, we have to remember that this fiber structure is inherited. Inherited. Now, the parents may not have had a fiber in exactly that place, but it's highly likely they either had a fiber in that location doing that exact same thing, or they may have had another health concern in that area. And what got passed down is the fiber for that genetic structure. So when we see fibers that are toddling off across other fibers, we have another one here. It's very, very faint, very fine. This client has a very fine fiber structure. We are going to ask personal and family history questions here. So we will locate where the fiber is, and we will determine what kinds of organs are in that organ reaction field. And then we will ask those general questions. Is there a personal or family history of a problem in this particular area? And so for that, we are going to, of course, need our iridology map. I'm just going to pull my favorite one out of my little holder there. In the right iris, when we are looking at fibers right here, we're looking at the base of the thyroid. And so I would be asking, are there personal or family history issues with thyroid? Now, remember, these specifically talk about a predisposition towards inflammation, scar tissue, and blockages. So we have to have a conversation with our client. And the reason we have to do that is because we only know the position of this fiber. We don't know exactly what it means until we have that conversation. In addition to that, if this is talking about a blockage, for instance, or inflammation or a risk of scar tissue, maybe this client has done a lot of work on their own health, and they've already done things and are currently doing things that will reduce their risk of inflammation, that will reduce the risk of forming scar tissue, and that will reduce the risk of having blockages in that area. Remember, this marking shows us a predisposition. It doesn't give us a guarantee. That's why we have to understand where our client is coming from. That's why we never look at an eye and do an iris assessment just from the photos without having a conversation. So again, depending on where these fibers are in the eye, there may be things we can recommend. Perhaps this client does have a thyroid issue. And we see this little fiber that says, oh, we want to have an issue with the base of the thyroid. We can then advise them as to dietary things, as to supplement things. Maybe there's some lifestyle things that could help. Right, with thyroid, we want to clean up the diet. We maybe want to look at some emotional things here as well, because we know that emotions will often trigger something that has its roots in the genetics of the person. So there's many different types of transversals in an eye, or there, I shouldn't say in an eye. Let me rephrase that. There are many different types of transversals, and each one of them means something slightly different. So as we don't have time to go into each of them today, that's actually an entire class session in the Dynamic Iridology Assessment System course. When we see these, though, we know that one of the common things that we are likely to see is an increased risk of arthritis, because arthritis is an inflammatory process. And so, with this iris type, and with this iris subtype, and with the fiber structure we see here, this person is at a greater risk for arthritis. And when she came to me, she's also a nutrition coach, so she knows a lot about that. But when she came to me, she was very concerned. In her mid-60s, she is a professional organist for a couple of churches, and she was beginning to have arthritic symptoms in her hands. And so I was able to say, well, systemically, you are at a greater risk for arthritis. There are many indicators here. And when we see that, we then know how to work with the diet. We know how to work with the mindset and the emotions, right? We know many things that we can do and recommend to help her stall off or even reverse arthritis. Now, I will tell you that I have arthritis, the same kinds of arthritis markers in my eyes. And my grandmother was seriously afflicted with arthritis. My father had serious arthritis, particularly in his hands. And at the age of 40, I woke up one morning and couldn't move my hands. They were very, very stiff. And I said to myself, you're too young to be this old, right? And my diet was pretty good, but I did a massive revamp in my diet, which my family did not appreciate because they got to come along on that ride with me, which has served them well. And I did a major revamp on the way I thought. And within a month or two, full mobility in my hands and no issues. And that was nearly 25 years ago. And so when we see these again, they are a predisposition. And we need to then take that step back and look at the context of what has this person brought to us? What do we need to be aware of with diet, with lifestyle, with emotional traumas, all those kinds of things to understand why they've developed symptoms in this predisposition and how can we begin to reverse that. Now, in reversing it, we are not going to take these fibers away. These are genetic. They are there for good. They're there as a reminder to mind your manners, to get your life in order, to get it all straightened out so that you don't have to suffer. These are the eyes of a 4-year-old child. She is a 3rd-generation client. I took care of her grandmother when her grandmother was having the mother of this little girl, and then I took care of the mother of this little girl when she was getting ready to get pregnant, and I took care of her through her pregnancy and still continue to take care of her as well as the family. I mean, I've got the aunts, the uncles, the cousins, I've got the whole family pretty well coming in, which is lovely. I love having that context because it gives me more depth to my understanding of why each person has the health concerns they do have. So again, we're watching to see that we're looking to see that this little girl has inherited her fiber structure, right? We've got lots of fibers going crisscrossy down here, and we've got some fibers up here that are also crossing over other fibers. And so the fact that we see this and we know that this is her inherent potential, this is what she's inherited from the previous generations, tells us what we need to do to help her stay well for her lifetime. What do we need to teach her? What does her lifestyle and diet need to be like now and moving forward for the rest of her life? So as we see this, I love doing iridology with children because there's no reason to panic here. There's no reason to go, oh my goodness, this is terrible, this is awful. No, this is just information. She has none of the symptoms that we would expect to see in someone who is older, who had these kinds of fibers that suggest a predisposition towards inflammation, scar tissue, and blockages, right? And so when we see this, we know that we are going to further coach her mother and reinforce that low acid forming diet, the anti-inflammatory diet for the whole family, because mom's eyes are very similar to this. Dad is also blue-eyed and has eyes that are fairly similar. And so it just underscores that, maybe the diet has slipped, maybe it hasn't, but it's an opportunity to, again, reaffirm that education that we've already given to the mom about what is best for this child. Now we're going to look at more eyes in just a moment. And so, but I want to ask you a question here. And that question is, why would anyone want to study iridology with me? I'm going to share an answer to that in just a moment. Megan's asked a great question. What type and subtype does she have? Megan, we're not going to dive into that kind of detail here today because we're staying focused on fiber structure right now. And certainly, if you want to flip back through my YouTube channel, you'll find many answers to those questions. You'll see I've done videos on those before, right? You've hit an important question though, Megan, and that is that understanding the constitutional type and the constitutional subtype add more layers. So we always start with the constitution, then we go to our subtype by structure and our subtype by color, and then we start looking for individual things that speak to the client's health concerns. And so you're right that we need that foundation in order to do a very effective iris assessment for the client. Great question. Thanks for asking that. So here is what one of my students said when I asked him, why did you choose to take my course? Why did you choose to study with me? This is Mike Knapp. He's a naturopath in Arizona. And as you know, as you may or may not know, in Arizona, naturopaths are considered on par with medical doctors. They are considered to be first-line healthcare providers. And he specifically answered the question with this. He said the interactive online platform with an experienced teacher and practitioner is what he was looking for. You said the fundamentals of iridology could be learned in this format, and that's what was delivered, plus a lot more on how to integrate it directly into current practice. I'm very happy with the training, so thank you. And then he goes on to say that he's been working on actively integrating it into his practice, and that's very exciting. Very exciting. I love to see that. What about when we have an eye like this that has such a dense amount of pigment over the surface that we don't see much fiber definition? That density of pigment hides the transversals, but it won't hide lacunae. We can see in here we've got some fiber separations. We've got some very tiny lacunae. These are actually called defects. And so if there was something significant going on, it would probably be visible in some way, shape, or form. However, even though we can't see fibers in here, we still get a lot of information from our hematogenic eyes when we know what we're looking for. Here's another dark brown eye. Do you see the difference between this one and the previous eye? If you do, give me the word difference in the comments box. So I'll flip back once more. And here, do you see the difference? Do you see how we see so many more structures in this eye? Again, we're not seeing individual fibers, but we are certainly seeing that there is some structural variety in this eye. And when we understand that with our dark brown eyes, again, it helps us to understand more of where we need to go and the direction we need to see. Now, some of you might be seeing this right here. These are not fibers, these are actually reflections of light and from the camera and from his eyelashes and things like that. What about this kind of an eye? This is neither blue nor brown, it's in between. And this is in this type of an eye, we might have pigment that is so dense that we don't see the individual fibers radiating out. But we might have some areas, like right here, where we can see a bit of the fiber. And specifically, right there, we have a transversal. So sometimes in these eyes that we can call biliary, sometimes we'll see enough fiber to see the transversals. And they will mean the exact same thing in a biliary eye as they meant in a blue eye. They will mean that there is a risk of inflammation, of blockage, of scar tissue. And again, we need to ask those questions. We need to understand, where is our client coming from? What is our client's health background? What is the family health history? Popping back to an eye that is mostly blue. As we look around, and when I'm looking for these transversals, my first way of looking for them is if the client has expressed a health concern, I'm going to look for transversals in areas of the eye that would speak to that concern. Then my second way of looking is going to be to do a general sweep. So this was a teenager, a 17-year-old girl. And I know her mom and her dad. This is a second generation client. And as I come around the eye, I see we've got a transversal here. This is her right eye. We keep coming down. Do we have any more transversals? We've got one right here. And so I can continue to look for these to decide if any of them are in areas that would be of concern, because they will then reinforce the dietary recommendations that I want to make. They will reinforce possibly some lifestyle recommendations, and they may give me added information. So if I am looking at this and thinking, this eye in general says she's a little bit prone to inflammation, but she also has transversals that suggest she may be prone to inflammation and blockages and scar tissue in specific areas. What are some general dietary recommendations you could make that would help her to not have inflammation? What are some anti-inflammatory dietary recommendations you could make? What are some things you would want to suggest she includes in her diet? And what are some things you would want to make sure she wasn't consuming? I'd love it if you'd give me some answers on that. Sherry says no sugar, no grains, and add greens. Brilliant recommendations, Sherry. Absolutely brilliant. Are there any other recommendations you can think of? Instagram and webinar guests? Anybody, anything else that you can think of? Megan is also saying get rid of sugars, get rid of hydrogenated oils and processed foods, eat more veggies and fruit. Love it. Teresita is saying add turmeric to the diet. That is fantastic. Fantastic. Shanaz is saying green juices, and Teresita is saying no coffee. These are absolutely spot on. Excellent recommendations. Those are the kinds of things that I've actually worked with this family on for the many decades that I've worked with them. Bree Herbals is saying, do the white parts of your eyes tell you have tumors? No, we don't have any specific markings that give us a specific diagnosis. We can certainly see areas that are hot spots where there might be something going on, but we don't ever from the eyes get to know exactly what it is. Shanaz is saying turmeric and ginger. Excellent recommendations. Excellent recommendations. Now, again, this girl's diet was very much on track because I've been working with this family for about 5 years from before she was born. And so they're very diet aware, very lifestyle aware. And I'm not overly concerned about anything I see in her eyes because I know she's very much on track and she has no symptoms. Here again, we have another client. She was in her mid-60s. She came to me with respiratory issues. And so as we look at her eyes, what do we see? We know the lung area sits over here, and we have a transversal coming through that lung area. We've got some other markers there as well that suggest that there might be some things going on. Now, here again, we have another transversal. And Shanaz is saying she loves my approach. Thank you so much. Love that. Thank you so much. And so as we see this, we know that there is that genetic predisposition. So this was her first appointment with me. She was fairly diet aware before she came to see me. But in looking at her eyes, we ascertained a few more things that she could be doing that would be helpful for her lungs, for helping to take the acid out of her lungs. She had a little chronic catch cough, which is a little worrisome because it can mean many different things. And so we started working with diet. But because what I call a catch cough, where they're constantly going, and there was no sinus or mucus dripping down the back of her throat, I wanted her to work with her doctor to get some testing done to see what they could find. And that was where we left off with her. She was getting the testing done. So she's still in process of that. All right, so now that I've given you a ton of basic information, would it be okay if I introduced myself? Some of you know me, some of you have been with me many, many times, and I truly appreciate that. My name is Judith Cobb, and I am a level 3 certified iridology instructor with IPA. I am one of only 5 level 3 instructors. It's the highest level of instructor certification they give. And I got into healing because I had health problems over 4 decades ago, and the doctors were not helpful in helping me get things organized, and it was then that I started to learn about natural healing. Over the 4+ decades that I've been in the industry and been working with people and coaching them, I've also written books that I've self-published and self-distributed. And their titles will show you where my passions are: Pregnancy Naturally, The Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature Sunshine Products, Biokinesiology and Color Therapy Level 1 and 2, and the Confident Nutritionist Dynamic Iridology textbook. I've created courses to go with every one of those books because I love teaching, and I want to get the information out and into the hands of practitioners who can then disseminate it to hundreds upon hundreds of their clients and just get all of this good information out there. I am also a certified nutrition coach, so I'm affiliated with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutrition Practitioners, and I'm also a master herbalist. And so again, I really spend a lot of time keeping my skills up, updating my skills would be a better way of putting it, because there's so much research going on in iridology and in nutrition and herbology. And so I've really appreciated all the interaction that you've been dishing out for me on this. And It Lies is asking, where can we get your books? All of my books are currently out of print, except for the iridology textbook, which is available to my students only at this point in time. All my books are due for a rewrite. I've learned so much since I wrote most of them 20 years ago that I would be embarrassed to put them out there now. That's my point of integrity, that if I know more, I want to give more. And so over the next few years, I'm hoping to update all of the books and get them back out there. And we now have Amazon, which is something we didn't have when I wrote the book, so I can distribute them there. Shanaz is saying, is your certification okay for Europe? And for Europe, I'm going to qualify that with, it depends on where you live. My understanding is that in Russia and Germany, you have to either be a medical doctor or a heilpraktor in order to practice iridology. To the best of my knowledge, the training is valid everywhere else. And so, especially if you have gone through my course and then certified with the International Iridology Practitioners Association. And in Paris, so Shanaz, again, I think that in Paris you're okay, but do double check your local laws to make sure. And Bree is asking, can we sign up for a class? You can certainly register for the class, enroll in the class. The next class, I'm going to give you details on that, but the course is coming up starting in January again. So Bree, I'm going to ask you to reach out to me by messenger so that we can be in touch about the class, because I would love to speak with you about it. And I know that iridology is valid in Ireland. There are many iridologists in Ireland as well. So let's just look at a little bit about why fiber structure is so important. This is a diagram that confused me for like 30 years until I finally, I don't know, the light bulb went off. I'd seen diagrams like this in textbooks. I went, what the heck are they talking about? And okay, just so that if it doesn't click for you right off, don't be embarrassed. Just know that's how it works sometimes. When we look at an iris, I'm going to flip back to an iris photo here to give us a bit more of a graphic. What we're going to do is we're going to take this iris and we're going to cut it right here. And we're going to look at that cut edge end on. So we've got the pupil, we're going to have the cut edge, and then we're going to see the white of the eye. That's what we're looking at here. We're looking at the pupil is right here. This is that cut edge that we're looking at end on, and the white of the eye would be over here. This whole area of the eye, which we collectively call the stroma, is made up of those fibers that we looked at earlier. The real name for those fibers is trabecula. Trabecula. And those fibers are actually not threads at all. They are capillaries that are coated in collagen. Okay. And so the iris of the eye has all of that circulation in it because of all of those capillaries that look like fibers. Does that diagram make sense to you? I would love it if you would just give me a makes sense if that cross section of one side of the iris makes sense. Just give me a makes sense in the comments box. Yes, Megan, fantastic. Fantastic. And Ashley's saying it makes sense as well. That's wonderful, just wonderful. So with that, I would like to introduce you to the Dynamic Iridology Assessment System course. This is a course for holistic practitioners. And by that, I mean anybody who's had a college level anatomy and physiology course. Now, I don't mean an entire program. You don't have to have graduated with a degree in anatomy and physiology. You just have to have had one course in whatever your studies are, whether it's herbology or nutrition or massage or whatever. Maybe you're a naturopath or a registered nurse, have to have had a course in anatomy and physiology in your studies. The reason I do that is because I teach at a really deep level that is meant for practitioners. And if you don't understand how the body is connected, you'll get lost within the first 3 or 4 weeks of the course. And when you do understand, we have so much fun diving deep, practicing not just the markings, but what the markings teach us about the body, what questions we would need to ask the client. What else does this mean? How does this tie into other things? How do we trace this back to the root of the problem? So this course is the only live, online, fully mentored course for health professionals who want to streamline their clinical work without sacrificing client care. What I see is too many health professionals see the client, gather information, then go off on their own to create a client program. And they'll spend 2 or 3 or 4 hours creating the client program and then email that back to the client. A couple of things happen then. Number one, you didn't get paid for those hours probably. And number two, you've probably given your client way too much information and they're probably snowballed and are struggling to use that information. So if they're struggling, they're not going to come back and see you. When we do iridology step by step, as a step-by-step process, we avoid overloading our clients, which means we give them what they need to move their health up a level. And as they move that health up a level and get results, they want to come back. What can we do to move my health up one more level? It helps us create long-term compliance, and it helps us get better results for our clients. So if you want to learn more than just iris markers, if you want to learn what the naturopath we saw earlier said, if you want to learn how to integrate this into your practice, then we need to talk. The course includes 20 live 2.25 hour web classes. So there's live interaction. You ask questions, we have discussions, you get clarification as you need it. And it includes all of these bonuses. You get recordings of every class session. Maybe you had to miss a class. Maybe there were things in a class that you missed and you want to go back and listen to it or watch it. There you go. Every topic is also recorded as a mini recording. Maybe there was just one thing you needed to review. Find that mini recording in that lesson and away you go. The textbook is a downloadable textbook. Now, I've kept it that way because you heard me say earlier that my other books are out of print right now because they need to be updated. That's why I've kept my Iridology textbook as a digital textbook, so that when we need to update the curriculum, I can update the digital version and give all of my students, past and present, access to the latest version. I don't know of any other teacher that will give you the newest version of their book as a gift if you've got the old version. We have downloadable cheat sheets. That's to help spur your memory and keep you on track when you're with a client. Every quiz has, or every module, every lesson has a quiz. So you can go in and you can test yourself to see if you're getting it. And I have a rule that if you've done a quiz 3 times and haven't got 100%, you have to reach out to me. And I say that with love because I want to go in and look at your quizzes, see where the problem was, and then give you direction as to where you can find the answers so that you get 100% on every quiz, so that you know you've got the right information. The quizzes also prepare you for the certification exam. That shouldn't be each week, that should be each month. We do 2 extra group mentoring sessions each month, which are open to all of my students and all of my grads. So you've got a question between classes, or maybe you graduated 4 years ago and you're actively using Iridology, which is my hope for you, but you've got a question, you're working on a case and you're not sure how to address it, or it's a really interesting case and you want to have a discussion about it, you bring that to the group mentoring sessions. This is long-term support for you. I don't know of any other teacher that does that. I mentor you for up to 10 months after your final class session to prepare you for certification. There's a specific process we have outlined, and this involves a lot of one-on-one time on my part, where you're doing assignments, extra assignments, I'm marking them, we're meeting to discuss them. Again, I put a limit on that for 10 months because I want you to get it done. You get a certificate of attendance for attending 80% of the classes live, or if you've had to miss a class and you've done the quiz, you will be marked as having attended that class if you get 100% on the quiz, even if it took you more than 1 try. And that's, again, for me to make sure that you've got the information, that it landed, that it makes sense for you. My quizzes are tough. And if you've got 100% on a quiz, which is my goal for every one of my students, then I know even if you missed that class, you got the content. Here's another bit of a teaser from one of my recent course grads. This is Sky, and she's a herbalist. She was actually not able to attend the classes live because she had scheduling conflicts. So she did the entire course through the recordings. She said, I could not have asked for better layout for learning. I was unable to make it to the scheduled classes, but the recordings of the classes were amazing. I loved the weekly quizzes. I'm glad to know that I always have you in my Iridology community to turn to if anything ever comes up where I may be challenged. Thank you for being a part of my journey and for all the support provided. You did not miss one detail. Love that. So the next course is starting on January 12th. If you are a health professional, if you've got that anatomy and physiology under your belt, and if you're interested in learning more about the course, I'm going to give you a way to reach out to me. But first, let's look at 3 generations. Let's look at how fiber structure and things get passed down. So this is the grandma. And I want you to notice how much of her fiber structure, how many transversals that we see in here were passed down to her son. Do you see them in there? Got one up here, we've got one down here, lots of them. We've got one over here. Now, of course, her mom, not genetically related to the grandma. And we see that the mom has a few little transversals, not as many as the dad, not as big as the dad. So when we look at the grandchild, what do we see? We see some of the larger transversals, one right here, for instance, but not too many. This child didn't inherit a lot of them. She inherited much more of her mother's structure. Okay, so that just gives an example of how they can get passed down depending on genetics. Any questions about fiber structure so far? Here's another 3-generation study. So here we have the mom, and you can see, or the grandmother. So generation 1, we can see she's got a transversal right there. And this is in her right eye. This is in her daughter's right eye. She has transversals in roughly the same area, a couple of them actually here, here, and here. And when we look at the grandchild, we again see transversals in the right eye in the same region. So again, we have the transversals that are all passed down, in this case, very strongly passed down through the 3 generations. One more quote from a student. This is Karen Choate. I asked her how has learning constitutional iridology helped her in her business. She said it's helped her to understand the relationships between different organs and organ systems. She's a certified natural health professional. She specializes in gut health. Iridology also gives me an advantage of seeing the potential for different genetic traits and qualities that may be underlying. By observing the constitution, for example, you can extrapolate how the person's body will likely respond to applications of healing methods. Therefore, it has helped me to expand my knowledge and increased efficiency at providing more precise recommendations for health-oriented options. She went on to say, it's been a great asset to me in my office specializing in digestive health. Iridology underscores the answers that I get from digestive testing and takes things to another dimension and a deeper level. Plus, people who've never heard of iridology are very curious about their genetic predispositions. If you would like to speak with me about the course, if you've got that anatomy and physiology under your belt, I encourage you to grab this link, tinyurl.com/dynamic-iridology-insight. And I apologize, I didn't put that anywhere that I can copy and paste it into the chat for my webinar attendees. That will be for you to, this link is to allow you to schedule a Zoom video call with me so we can talk about you, talk about your background, talk about your goals, talk about what you do, and see if this course is a good fit for you. I only allow students into the course if I've spoken with them personally. And that's not because I want to strong arm them into anything. It's because I want to make sure that they are a good fit. I want to make sure this is a good fit for them as well. It's so important to me that this is the right course and the right time for you to be taking this course. So important. I only take 10 students per course. And when it's filled up, then we wait until the next start date. And so, again, this course starts on January 12th. And if you are interested in learning more, then please use that link and reach out to me and let's have a conversation. So Bree Herbals, there you go. Reach out to me here. And I will also try to reach out to you to make sure you've got that contact information, as well as Shanaz, I will reach out to you as well. All righty, there we have it. I just need to make some quick notes so I know who I'm reaching out to. And Bree Herbals. Amazing. Thank you so much for being with me. Just before we close it down, any questions, anything else that I can help you with? Are we good? Are we good? Yeah? All righty. Not seeing anything else come in. I would love to chat with any of you, and I look forward to speaking with you very soon. Take care and have an amazing day. Bye for now. Hi there. Thanks so much for watching. Remember, if you liked this video, give me a like and share it with a friend and leave a comment and subscribe to this channel. It would help me out so much. Thanks so much for your help. Bye for now.